Hello, if you're seeing me for the first time, my name is Uzochinyere Nancy. I'm a Nigerian registered nurse. On that note, I would like to wish all registered nurses out there happy International Nurses Week. Yay! And I'm one of them. You people should wish me happy International Nurses Week. It's our week. To the nurses out there, thank you for all you do. Thank you for going out of your way to render holistic and compassionate care to patients. You are well celebrated, you are appreciated. God will continue to reward you. Namaste. So let's quickly look at sex. I don't mean the act of being male or female. I mean the sexual act, that is coitus. We'll be looking at practicing safe sex. So before we look at ways of practicing safe sex, what is safe sex? It is any sexual contact that protects you and your partner from getting STIs. STIs means sexually transmitted infections and pregnancy. I'll be listing few ways, points on how to practice safe sex. One is use of barrier methods. That's correct use of condoms. 2, use of dental dams. Dental dams are thin, flexible piece of latex that can provide protection during oral sex. It provides protection during mouth to vagina and mouth to oral sex. It is being placed on your partner's vagina or anus to create barriers between the mouth and the vagina or anus. It is not reusable. Dental dams now use and throw away. They know they use and keep, they know they use and wash them. It is used once. Another method is STI screening. Go for STI screening and also STI treatment. If you go for screening and you are found positive of any sexually transmitted infection, you treat it. The earlier, the better. Reducing of multiple sexual partners. Yeah, that's another means of practicing safe sex. When you stick to only one sexual partner. Even when you're even sticking to that one sexual partner, you guys still use protection, because when you're sticking to that person, you don't even know if that person is sticking to only you. I mean, the person get multiple sexual partners. That's another disadvantage of that. Which is the more reason why, even if you're sticking to one partner, still use condom, because you never can tell. Then another point that I want to mention is washing of hands before fingering, or you use latex gloves. All of una wey be say una nails grow, ndị na-eruwe karimbo with long nails. Hope you know that microorganisms can embed, according to English, so embed, can embed under the nail bed shaving. When germs stay there, and you use that hand and insert it in a lady, or even use it to stimulate the clitoris, she gonna know say una go fit send infection to that person, which is the more reason why you have to keep your nails short. Wait, apart from even transmitting infection, you can even wound the person with the grown nails. When you are trying to stimulate the clitoris or whatever, you can still get the person wounded. So please cut your fingernails, wash your hand with soap and water. You can still use latex glove. Another point is, that's why I made mention of was that dental dams. Do you know that if you have wounds on your mouth and you do oral sex, be you a male or a female, and you perform oral sex, there are chances that you can get warts from there. Yes, that's if the lady has warts or the guy has genital warts, and you have a wound or blisters on your mouth, chances of being infected are also high. So now you see why dental warts is necessary. The weather is really hot here. See the way I'm sweating like a Christmas goat. So with these few points of mine, I hope I am being able, how would I even speak? I hope I'm able to communicate and to pass knowledge to everyone out there. Please, let's try and be practicing safe sex for our own good and for the good of our partner to avoid STI. STI is sexually transmitted infection, and STI can also lead to infertility in case you don't know it now. Thanks for watching. Thanks for listening. See you guys in my next video. Bye.